Now, before we get started, I just wanted to briefly share with you a bit about Episcopal Communities and Services, your host for today, and the communities hosting the session this morning. Episcopal Communities and Services has been serving seniors since 1923, so almost 100 years. ECS owns and manages retirement communities from affordable housing to high-end life plan communities. The 3 retirement communities hosting this morning's sessions are as follows. The first is the Canterbury, which has been serving seniors for almost 40 years. The Canterbury is located on the hill in Ranchos Palos Verdes with a rooftop deck that has spectacular views of the Los Angeles area. The Canterbury has a total of 150 living accommodations. Our second community hosting this morning is the Covington, serving seniors for 16 years now, located in Aliso Viejo with Saddleback Mountain views. The Covington has 213 living accommodations. And finally, our third community host is Montecedro, serving seniors for almost 5 years now and is nestled in the foothills of Altadena, surrounded by the San Gabriel Mountains, and is the newest life plan community built in the greater Los Angeles area in over 20 years. Montecedro has 203 living accommodations. We will have contact information for you at the end of the session and hope you contact us to find out more. We are happy to be here this morning, and for those of you who are just joining, welcome to today's webinar titled Immunity Boosting Foods, a Clinical Approach to a Healthy Lifestyle. I am now going to hand off the mic to Tracy, who will introduce herself and our speaker for this morning's session. Tracy?
Thank you, Krista. Good morning, and thank you all for joining us today. I'm Tracy Stevick. I am the Director of Sales at the Covington. It's truly an honor and a privilege to have Dr. Trinh join us today. He's a prominent figure in the local healthcare community and with quite an impressive background. I'd like to read a little bit of his bio for you before we get started. Dr. Trinh is the Chief Medical Officer of Irvine Clinical Research, a board member of Alzheimer's Orange County, a physician with Memorial Care, and is a medical missionary with TongueOut Medical Missions. He's a keynote speaker, best-selling author, and health educator who speaks throughout Orange County on various preventive health topics. And with that, I'll turn it over to Dr. Trinh.
All right. Can you guys see me okay?
We can. Thank you, Dr. Trinh.
Thank you.
All right. Are we on gallery view or how we?
We are in speaker view.
Speaker view. Very cool. I'm getting my my own thing set up here. Okay, awesome. Is everyone able to, you guys who are on the site here, is everyone able to comment in the chat box? Type in yes if you can. I want to make sure that you're able to comment in the chat box because I want to make sure that you can ask me questions if you need to ask me questions and comments and things. Very cool. Okay. Laura, I see Patricia, Catherine, Virginia. All right. See you guys, Jennifer. Very cool. So everyone knows how to access the chat box, which is important because if you guys have participated in any of my lectures before, they're not really, you know, one-way lectures. They're more like conversations with you to address concerns, questions that you have on the topic at hand. And so the chat box is the best way to address that. My first question to you is, how's everyone doing during this pandemic? Are you guys, everyone has a mask? Are you guys loaded up with toilet paper for 6 months? Does anyone, I mentioned that because if you need mask, we actually have masks that are available at no cost over at Alzheimer's Orange County. You would just have to email me and come and pick up masks. It's one of the services that we provide is to offer masks to those who don't need that. I'm gonna put my email on here for you guys as well, so that if I don't address anything that's burning on your mind during this chat over the next 50 minutes or so, you can email me And my email is there in the chat. It's just my name at alzoc.org. And if you need masks and things of that sort, you can let me know as well and drop by to pick those things up. Today's topic is on immunity and and food that would help with your immune system. My first question to you is what does immunity has to do with coronavirus and in general, and how does coronavirus actually affect how does coronavirus kill a person? Heavy question there for you guys. And I ask that because the one thing we should all learn and know, which not a lot of folks know, is that the strength of your immune system is going to determine if you're going to survive the pandemic. And when we think about the virus and we think about how this virus affects someone who is immune suppressed or whose immune system isn't as good as it should be, what we ought to know is that it isn't really the virus that kills you. When we talk about this pandemic, what kills us is our immune system in trying to attack this virus. Are you guys following me so far? I want to make sure that as I talk, you're following and that I haven't lost anyone. So type in yes if you're following me and you're understanding what I'm saying so far. Okay, very cool. Jane, Suzanne, Laura. So it isn't the virus that kills us. It is the immune system that actually gets us, which is why this is a topic that is relevant. Does anyone know how the immune system actually kills us when it comes to COVID? If you have any thoughts on it, you can type it in the chat box. Does anyone know how the immune system actually gets us when it comes to coronavirus? Jen says it attacks our organs. Renee says cytokine storm. Liz says not enough white blood cell. Ida says yes, yes. Right? So has any one of us developed a bruise before when we have gone out and somehow tripped over something or stepped on something and in a matter of minutes to the area of injury, right? If you slipped on something and you twisted your ankle or you injured your ankle, the area of injury, what happens to that area of injury in a matter of minutes, guys? If you were to injure, your foot, if you stepped on something and, right? What happens to that area of injury in a matter of minutes? Bruise, what does that bruise look like? What does that bruise look like? Vivian says swells up, yes. Tracy says inflammation. Jane says it looks dark. Jen says purple. So there's swelling. There is heat, right? It gets hot. Dell says it can get infected. Yes. Vivian says bruise. It turns color. So in a matter of minutes, when there is an injury to a part of our body, right? The white blood cells rush in to fight or to protect itself from that area of injury. So yes, Virginia, white cells rush in. That is absolutely correct. So your white blood cells is really your immune system, right? These white blood cells and the antibodies, and that's your immune system rushing in to an area that is damaged, to an area that is trying to protect. And when your immune system rushes into that area, it produces inflammation. It produces all these inflammatory things that is the result of a battle that's going on, right? Anytime your white blood cell or your immune system is trying to fight something that should not be there, the consequence of a battle, of a fight between the immune system and something that should not be there, the consequences of that is inflammation. And that inflammation looks like a bruise. It gets swollen, red, blue, purple. There's heat involved. There's pain involved, right? A lot of inflammation comes into that area. Are you guys following me so far? With inflammation as a result of the battle between your immune system and something that is not, should not be there. Okay, yes, 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 Ida. Great, because I want to make sure I don't lose anyone as I'm talking, right? Good. Coronavirus. How does it enter your body? How does it enter your body? It enters our body through several portals. Yes, nose, respiratory. Absolutely correct. It also enters your body through your eyes, but it's not a common thing. But oftentimes eyes, nose, and mouth, right? Eyes, nose, and mouth is how it enters our body. So, somebody sneezes on you, coughs on you, who's infected, or you go and you touch a door handle, and that door handle was touched by somebody else, so that's COVID, right? And then what happens is you get coronavirus on your hand, and then little do we know, we're like this on our face, we're like this, we're messing with our hair, right? And you get coronavirus on your face, and that's how it enters your body, which is why wearing a mask is important, right? You're protecting portals of entry with that. And coronavirus enters here, gets into the lungs. When the coronavirus gets into your lungs, it attaches to your lung cells, right? It attaches to the alveoli and to your lung cells, and it gets inside and it does this thing. It starts to divide and grow and all that stuff. So your immune system recognizes that there's a virus in the lungs. And I want you to take all that inflammation that you can imagine in a bruise, right? The swelling, the extra fluid, the heat, right? The discoloration, the temperature, right? The heat and the pain and all. I want you to take that big load of a bruise that is in your ankle or in your foot, and I want you to bring that whole load into your lungs. That's exactly what happens when COVID gets into the lungs. And the symptoms of that is when you have all this inflammatory fluid in your lungs. What are the symptoms of having your lungs drown in inflammatory fluid, guys? What are the symptoms of that? Type it out. What are the symptoms? Right? Shortness of breath. Yes, shortness of breath, which is why one of the symptoms that we think about to hospitalize a patient with COVID is shortness of breath. And as your lungs is getting flooded, right? Coughing, shortness of breath, fever, all these respiratory symptoms. As your lungs is getting flooded with inflammatory fluid from your immune system, right? Responding to the virus. As your lungs is getting flooded with an inflammatory fluid, you get shortness of breath. Not only do you get shortness of breath, what happens to your oxygen level? What happens to your oxygen level as this inflammatory fluid builds up in your lungs? That's absolutely correct. Pressure in the chest and oxygen level drops. That's right. Your oxygen level drops, right? That little pulse ox they put in somebody's, finger, right, to check your oxygen level, that drops. Now you know why it drops. It drops because your lungs are filling up with inflammatory fluid. Inflammatory fluid, not from the virus, inflammatory fluid from your immune system trying to fight, right? One of the measures that we look for, one of the metrics that we look for to identify who should be hospitalized from coronavirus and who does not need to be hospitalized and can go home and isolate is your oxygen level. Because we need a certain oxygen level to survive, right? And if your oxygen level drops under a certain percentage, then those are the folks that we hospitalize, and then we give them oxygen and things of that sort, right? And usually that level is around 90% or a little bit higher. Is it beneficial to have oxygen on hand? If you are infected and your oxygen level is low, yes, you need oxygen. How do you get oxygen in hand? I'm not sure. Maybe you can go to one of those oxygen bars. I don't know if you've seen those things, but maybe you shouldn't if you have COVID, right? I've been out in Vegas and I've seen these oxygen bars where people sit and they just breathe oxygen. First of all, if you don't lack oxygen, guys, you don't need extra oxygen. It doesn't do anything for you. But I'm sure it's a very profitable business. People's trying to sell oxygen. But if you do lack oxygen, it's why we hospitalize patients with that. So I wanted to give you this scenario because COVID kills due to inflammation. COVID kills due to inflammation in your lungs, right? It creates inflammation, which is why we need to have a lifestyle that is anti-inflammatory to reduce, right? To reduce the body's baseline inflammation. The lower you can reduce your body's baseline inflammation, the better you can handle infections overall, including COVID with that. Vivian says, probably need oxygen in Vegas due to all the smoke. Yeah, that's right. Yeah, I don't handle the smoke very well at casinos, which is why I don't gamble. I just kind of run through the casino to wherever I need to go, to the buffet or to a show. But yeah, I've never really done any gambling because of the smoke. And plus, I'm not a very good gambler anyway, guys, with that. So let me ask you another question. Inflammation is caused by simply your immune system trying to fight the bad guys, something it doesn't recognize, right? Whether it is a virus or I don't know, or a bacteria, or a mold or a fungus, or even a toxin that shouldn't be in your body, inflammation is produced, right? Because your immune system tries to fight it. Did you know that the majority of diseases we have today, guys, is somehow linked or caused by inflammation? Did you know that? The majority of diseases we have today is somehow linked or associated with inflammation. I mean, you can name any organ system in your body, any organ system, name me a few diseases that is part of that organ system, and I can link it to inflammation. Type out some organ systems, guys, in our bodies. And let's see if we can, Suzanne says the spine. Okay, so the joints, right? The joints. What are some conditions of the joints? Arthritis, right? So did you know there's not one type of arthritis? There is rheumatoid arthritis, There's osteoarthritis, there's gout, there's right, psoriatic arthritis, right? I've named you several types of arthritis. One cause behind arthritis, what is it? Inflammation, right? We can, yeah, that's right, Virginia. Inflammation is behind all the arthritis. Isn't that crazy? We can name all the different arthritis, all the different diagnoses of arthritis. It's only one cause behind that. Name me another organ system. Name me another organ system. All right. So, somebody, Regina says kidneys. So your kidney system is kidneys and bladder. Have you ever heard of a condition called glomerulonephritis? Glomerulonephritis is where you have inflammation of the kidneys, of the glomerular tubes of the kidneys. We see that with IgA nephropathy and several different types of nephropathy, inflammation-induced. Acute cystitis is a bladder infection. You guys know about UTIs, urinary tract infections, right? Bladder infection is cystitis, which is inflammation of the bladder, right? From a bacteria, like usually it's E. coli that infects your bladder. It's inflammation induced, right? Kidney stones, when they get stuck in the little tubes, very painful. It causes inflammation and usually hospitalizations from kidney stones where we have to zap it out with lithotripsy. That's inflammation induced as well. Right, so even the kidney bladder system, we named a few different diagnoses, all inflammation induced, all inflammation induced. Jane says intestines. Name me a few intestines conditions, guys. What are some intestinal conditions that you can have? Crohn's disease. So Crohn's disease is simply inflammation of your GI tract. Have you heard of ulcerative colitis? Have you guys heard of ulcerative colitis? Ulcerative colitis is simply inflammation of your colon, right? Diverticulitis. Virginia says diverticulitis. That's simply inflammation of the little pouches that attaches to your colon, right? The diverticulus. Cancer. Yes, Del, cancer is driven by inflammation. Lactose intolerance. The symptoms of lactose intolerance is basically inflammation induced with that, right? IBD, yes. So do you see how we took one system, the GI system, we linked all types of conditions associated with it, whether it's Crohn's disease, ulcerative colitis, right? IBS, lactose intolerance. Do you see the one theme behind all those diagnoses? The one theme is inflammation. Pancreatitis is inflammation of your pancreas, right? Acid reflux is simply inflammation of the stomach or the esophagus, right? We call it heartburn, inflammation induced. Hepatitis is simply inflammation of your liver. Isn't that crazy? Everything is linked to inflammation, guys, with that. And that's just, the GI system. We did the kidney system. We did the joint system. What about your skin? What are some conditions of your skin? Name me some skin conditions, guys, with that. What are some skin conditions? Common cold, yes, caused by a virus. Yes, Regina. Eczema, psoriasis. So psoriasis is just inflammation of your skin. Eczema is simply inflammation of your skin. Dermatitis is inflammation of your skin. Acne is inflammation of your skin, right? So that's just another organ system, the skin, right? All the conditions we have mentioned is linked to inflammation. Are you seeing a trend here, guys, between diseases and inflammation? Are you seeing a trend here between diseases and inflammation? Pretty crazy, isn't it? Right? Somebody mentioned the heart, right? How is the heart linked to inflammation at all? Is the heart linked to inflammation at all? When I think of heart disease, the #1 killer in the United States, the #1 killer in Orange County, right? Heart disease. I think of heart attacks. And heart attacks is clogging of what, guys? Heart attacks is clogging of what? What clogs up with heart attacks? Endocarditis, clogging of the arteries. Yes, yes, clogging of the arteries leads to the #1 killer in the United States and in Orange County. Let me ask you this: what clogs up the arteries? What clogs up the arteries? What clogs up our arteries, guys? Okay, plaque and cholesterol. That's correct. So it is the cholesterol plaque that clogs up the artery. Yes, it is the cholesterol plaque. Now, let me ask you a deeper question now. We're going to dig deeper. Why does the cholesterol even stick to the walls of the artery, right? So you have this artery, right? And the inner lining of the artery is called the intima, right? It's called the intima. That's the inner lining of the artery. Why does the cholesterol even stick to the arteries in the first place? Why doesn't the cholesterol just keep floating around, you know, in the blood and never stick to the arteries, right? Why does cholesterol even stick to the arteries in the first place? Suzanne says age, Reggie says sticky, Laura says some is supposed to be there, Regina because it's too much. So the cholesterol sticks to the artery wall because the artery wall is sticky. So sorry, that wasn't very scientific. The artery wall is sticky. So my question to you is, what makes the artery wall sticky? What makes the artery wall sticky, right? For cholesterol to bind to it. And the artery wall gets sticky when it gets damaged. When it gets damaged. And so I'm going to ask you one last question to dive a little bit deeper. What causes the artery wall to get damaged? Right? The artery wall gets damaged, it gets sticky. It gets sticky, cholesterol binds to it. Cholesterol binds to it, it creates a plaque that leads to clogging of the artery, and it leads to a #1 killer, a heart attack. I'm going to type in my answer. What damages the artery wall? Okay? What damages the artery wall, guys, is inflammation. Inflammation is behind heart disease. That's what damages the artery wall. There's actually a blood test that we can check. It's called the CRP. I don't know if you guys ever heard of it. CRP level. It stands for C-reactive protein. It is, yes, that's right, Tracy. C-reactive protein is a blood marker for inflammation. It is also an independent risk factor for heart disease. Patients who have an elevated CRP, right, is at risk for heart disease. It is a risk, and it is a marker for inflammation. If your CRP level is high, it means you are inflamed internally. And guess what? There's no symptoms. There's no symptoms with that. So even heart disease is caused by inflammation. Crazy trend, is it? Let me ask you this. What do we call inflammation of the brain? What do we call inflammation of the brain? Does anyone know? All right. What do we call inflammation of the brain? Encephalitis, stroke? Of the brain. Let's see, turn your TO to all panelists and attendees. How do I do that? Let's see here. What do we call that? Oh, chat box. Turn your chat box. In the chat box, all panelists attendees. Okay, can you guys see me type? Hold on. Can you see me type? Can you see me type? It says, oh, okay, hold on, okay. Okay, you can see me this, can you see me now? Type. Cool, okay. Here, take this down, guys. This is my email, because I know you're gonna have questions after all this. If you have further, it's just my dung.trin@alzoc.org if you wanted to email me later on for anything. So, cool, you can see me now, yay. You can see me type now. Inflammation of the brain, I call Alzheimer's. Alzheimer's is the third leading cause of death in Orange County. Heart disease is the #1 cause of death in Orange County. Does anyone know what the #2 cause of death in Orange County is? Anyone know what the #2 cause of death in Orange County? Type it down if you have a guess. Skin cancer, #2 cause of death in Orange County? Somebody says COVID. Wow. Heart disease is #1, Vicky. #2 is cancer. #2 cause of death in Orange County is cancer. #3 is Alzheimer's. Guess what, guys? Inflammation plays a role in the top 3 causes of death in Orange County, whether it's heart disease, COVID, cancer, or Alzheimer's. Inflammation. And I wanted to set this setting up for you because now you understand why it is so important to learn about foods that are anti-inflammatory. Does that make sense to you guys? Does that make sense for you guys? Why it's so important to learn about foods that are anti-inflammatory. What's the average age of OC residents? Regina asked. The average age or how old we get before we die? The average age of death? I think an Orange County resident lives up to their mid-80s. As last time I checked, Regina. Most of them are in Laguna Woods area hanging out. I speak there all the time in Laguna Woods, probably weekly, on some type of event where a lot of our patients there. But now that you understand that literally all diseases can be linked to inflammation, including COVID, it's so important to live a lifestyle that will minimize the risk of inflammation. Let me ask you this. Before we get into nutrition, right, and specifically foods that lowers inflammation, before we get into nutrition and foods that lowers inflammation, Vivian wants me to retype my email. Hold on here. alzoc.org. There's my email, right? It's just my name separated by a dot at alzoc.org. It stands for Alzheimer's Orange County, right? .org. Before we get into the foods that lowers your risk for inflammation, let me ask you this. What else can we do to lower inflammation besides food? What else can we do to lower inflammation besides food? Okay. Suzanne says water. Vivian says, yeah, you guys are good. Yeah, totally. Yes. Exercise. Exercise lowers inflammation with that. And it lowers inflammation by improving circulation. As you improve your circulation, it washes out inflammation. It washes out areas where inflammation may get stuck in with that. Exercise is anti-inflammatory, guys. Did you know that if you exercise, not only will you lower your risk for heart disease, you will also lower your risk for Alzheimer's by at least 30%, if not more. Studies have shown that those who exercise on a consistent basis lowers their risk for heart disease and Alzheimer's on a regular basis. That's right. Virgie says, meditate. Yeah. Did you know that stress induces inflammation? Did you know that stress induces inflammation? It's kind of scary because we live in stressful times, don't we? We live in times of high anxiety, depression with COVID, with being stuck at home, right? And what happens is that stress increases your body's cortisol level. And the cortisol level is your body's own natural steroids to try to address stress. And in having chronic elevated cortisol level, it is linked to inflammation as well. So yes, looking for ways to reduce stress, guys, will certainly help with inflammation as well. You can reduce stress with exercise. You can reduce stress with meditation. You can reduce stress with yoga. You can reduce stress with, I don't know, talking to a counselor, having a good social network, friends and family that you can talk to. Many ways to reduce stress because stress can increase inflammation. Yes, so that's another factor. Inflammation is a silent killer, Tracy, because how do you know if you're inflamed or not right now? We're all sitting here, right? There's over 50 of us here sitting and looking at my Zoom screen. How do you know if you're not inflamed or if you are inflamed? I mean, none of us know our CRP level, right? Did you know you can get it checked? It's a simple blood test, the CRP level. It's a simple blood test. None of us know our CRP level sitting right now, right? And so how do you know if you're inflamed or not? Which is why you are correct, Tracy. It is a silent killer. There's not always symptoms of inflammation unless you're walking around with arthritis and you know you're inflamed. But here are the symptoms of inflammation. The symptoms of inflammation is Alzheimer's. The symptoms of inflammation is heart disease. The symptoms of inflammation is obesity, diabetes, right? Eczema, psoriasis. The chronic medical conditions we all suffer with today are symptoms of inflammation, and that is linked to nutrition and our diet. Isn't that crazy? Did you know that we are simply the product of our food? I truly believe that our food is our medicine. No, I'm not a guy that, would love to prescribe this and that all the time unless I have to, right? And there are many cases where I have to. If I can't control your blood pressure, you're on a blood pressure med, or your cholesterol, you're on a statin, or, your Alzheimer's, you got diazepam or different things of that sort. But we truly are what we eat. And there are foods that are pro-inflammatory and foods that are anti-inflammatory. What are some pro-inflammatory foods, guys? What are some foods that create inflammation? Type that in the chat box. What are some foods that create inflammation? I see sugar, I see wheat, I see fat, dairy. Wow, grain. You guys must have been reading like the Grain Brain book by Dr. Is it one of those? It's one of that doctor. Gluten. What are some pro-inflammatory foods? So sugar is a culprit. Sugar is a culprit. And the problem with sugar is that it is everywhere. It is the American diet. It is the American diet. And when I talk about sugar, guys, I'm not just talking about candies, cookies, brownies, cakes, and desserts. When I talk about sugar, what am I really talking about, guys? What else is sugar besides the obvious? Elizabeth says fructose. Yes, the food companies hide the word sugar very well in our labels. They call it fructose, sucrose, maltose. Patricia, yes. When I talk about sugar, guys, I'm talking about carbohydrates. I'm talking about the American diet. Because the white bread that we eat, the white rice that we eat, the spaghetti, the pizza, the bread buns on our hamburgers, what do they break down into, guys? Right? Potatoes. What do they break down into? That's right. They break down to sugar. And this is like another 1 hour lecture that I give on sugar. I normally give a 1 hour lecture on sugar and the science behind it and all that. But let me give you a quick synopsis on why sugar is pro-inflammatory. When you have too much sugar, right? When you have too much sugar in your bloodstream, the excess sugar goes to three locations. It first goes to your liver, and it deposits in your liver. And when it does that, we call that fatty liver. Anyone heard of fatty liver before? The word fatty liver? Does that ring a bell? Did you know that fatty liver is simply having too much sugar in your liver? It converts over to fat. And the issue with fatty liver is this. Fatty liver is becoming the #1 cause of liver transplants in the United States. Think about that. Fatty liver is becoming the #1 cause of liver transplants in the United States. And it leads to cirrhosis, it leads to a hepatitis type. And so that's the first area of deposit of too much sugar. It goes to your liver, leads to fatty liver, leads to liver failure and cirrhosis and liver transplant. The second place that too much sugar goes to is, does anyone know the second place that sugar goes to when there's too much sugar in your bloodstream? And too much sugar results from the carbs that we eat. Does anyone know the second place? Not kidneys. We pee out the extra sugar, but it does. Regina says goes to your hips. Ooh, not brain, not pancreas, not pancreas. The pancreas makes the insulin to bring down the sugar. The brain does use a lot of sugar, but it doesn't deposit there. The second place that sugar goes to, and the sugar is in the blood, but it goes somewhere because it's too much of it. The second place that sugar goes to when there's too much sugar, guys, it goes into our fat cells. It deposits into our fat cells and it makes us fatter. Sugar deposits into our fat cells and it makes us obese. Isn't that crazy? Did you know 2 out of 3 Americans are either overweight or obese, right? 2 out of 3 of us are overweight, basically, or obese, which is kind of crazy. What that means, guys, is this. Obesity is a symptom of inflammation. Obesity is an inflammatory disorder. We don't think about that, but that's exactly what it is. Obesity is an inflammatory disorder. And forever growing up, I have always been taught that if you want to lose weight, or if you want to lose fat, if you have too much fat and you want to lose fat, the diet that I need to be on is a low-fat diet. How many of us have been taught that? If you want to lose fat, the diet you ought to be on is a low-fat diet. How many of us have been taught that? Right? If you want to lose weight, it's a low-fat diet that we need to be on. Right? Forever we've been taught that. And I can say that we have been good in doing that. So if you were eating a steak and there is a rim of fat around your steak, what do you do to that? If you're eating a steak and there's a rim of fat around your steak, what do you normally do to that rim of fat? Yeah, you cut it out, you avoid it. Yes, Laura, yes, that's right, Krista, that's right, Jen, right? We all do that. We have all been trained to cut the fat out when we see it, to trim off the fat. And let me ask you this, if we are all doing that and we are all trimming our fat away from our diet, why is it that 2 out of 3 Americans are overweight? Why is it that 2 out of 3 Americans are overweight? That's correct. Eat too much. Guys, it's not the fat. We are overweight because of the sugar and the carbs that gets deposited into our fat cells. Does that make sense with that? So sugar drives obesity. Obesity is simply a problem with inflammation. Now, the third place that sugar goes to is this. When you have too much sugar, right, in your bloodstream, sugar isn't the only thing that's in our bloodstream. We have other things floating around in our bloodstream. We have proteins floating around in our bloodstream. We have red blood cells, white blood cells, which is the immune system. We have molecules floating around our bloodstream. Lots of things are floating around in our bloodstream, right? What happens is the sugar, because there's too much of it, it attaches and it hitchhikes. It hitchhikes onto everything that's floating around in the bloodstream. So what we normally see is we see these proteins floating around with a sugar tail. A protein with a sugar tail. Right? Can you imagine that? These proteins with sugar tails that are hitchhiking, right, in your bloodstream? And I call them sugar tails, right? Did you know there's a scientific name for these sugar tails? Does anyone know? There's actually a scientific name for it. I'm going to type it out for you so you can look it up. Advanced glycation end products. It's a long name, advanced glycation end products. And what it is simply sugar tails. Now these sugar tails that's floating around, and there's a lot of it. If you ever Google advanced glycation end products, Wikipedia will pop up and you're going to learn that these sugar tails, these advanced glycation end products, is the cause behind chronic disease. It is also the cause behind aging, why we get older. Why we get older. Now how is this all related, right? To inflammation. And here's how I'm going to connect it for you guys. Your immune system, which is in the bloodstream, is looking around and it sees these different sugar tails floating around, right? Your immune system is seeing these sugar tails, which is proteins with a tail behind it because it's too much sugar, it's hitchhiking. And your immune system is like, what is that thing? I don't recognize what that is. It may have recognized the original protein, but the original protein has now changed in shape and form because there's now a sugar tail. What does the immune system do, guys? What does the immune system do when it sees something that it does not recognize? What does the immune system do to it? Right? Type on the chat box. What does the immune... That's right. That's right. The immune system attacks it, doesn't it? That's right. And guys, when the immune system is attacking something, what is created? What is the byproduct of this fight with the immune system's attack? What is the byproduct? That's right. The byproduct, guys, is inflammation. That's right. And I have connected for you the connection between inflammation and chronic diseases, inflammation and Alzheimer's, inflammation and heart disease, inflammation and how coronavirus kills you. Do you see how your nutrition is so important with all this? What's the biggest offender leading to glycation end products? The biggest offender is sugar. And I'm not talking about cookies, cakes, and ice cream. Yes, I am talking about cookies, cakes, and ice cream. I'm talking about the American diet, which is a diet full of carbohydrates that break down to sugar. So if you want to minimize your inflammation, your internal inflammation, you know what you need to avoid. Not just sugar, although sugar is the primary culprit, right? Sugar is the primary culprit. Not just sugar. Processed foods is something that the immune system does not recognize, right? Processed foods, meats, red meat. Why do I say red meat, right? Dairy processed foods. Right? Red meat is also pro-inflammatory because when you eat beef, you're not just eating beef, you're eating everything that we pump into the cows, right? What do we pump into the cows, right? And so we pump hormones, we pump antibiotics, right? And when hormones and antibiotics get into your bloodstream, what does the immune system do? It attacks it. So are you guys ready for anti-inflammatory foods? Are you guys ready for anti-inflammatory foods? I'm going to give you 10 things right now. Pen and paper, write them down. I'm going to give you 10 things. Anti-inflammatory foods. Number one, green leafy vegetables. Green leafy vegetables is an anti-inflammatory food, okay? Number two, any vegetable that is not necessarily green and leafy. So anything that comes out of the ground. Number three, berries, blueberries, blackberries, raspberries, strawberries. Berries has a lot of antioxidants, okay? Berries has a lot of antioxidants. Anything that's an antioxidant suppresses inflammation. Number four, nuts. Nuts. Try to get a few servings of nuts in per week. And a serving is just a handful of nuts. Nuts is anti-inflammatory. Number five, olive oil. Olive oil. And I'm speaking specifically about extra virgin olive oil, which is part of the Mediterranean diet. Olive oil has been shown to lower both heart disease and Alzheimer's. So replace the other oil you have at home with olive oil. Next one, and we talked about the evils of grains, right? Because we don't recognize the grains we eat anymore. It's been GMO, genetically modified, compared to grains that we had 50 years ago. But the next one is whole grains. Whole grains. And I mentioned that because the important thing here is the word whole. Because whole means fiber. You want to have fiber. Fiber is super important. It lowers cholesterol. It helps with digestion. It helps with lowering heart disease and Alzheimer's as well. Laura says, are there some nuts that are better than others? Walnuts have a lot of data behind it, but all nuts are important. Next one is fish. Fish. Fish has omega-3 fatty acid. Fish has omega-3 fatty acid, okay, which is a strong antioxidant. Next one after that is beans. Beans. And it could be refried beans, black beans, I don't know, Mexican jumping beans? I'm not quite sure. All these different types of beans, right? Everything except for jelly beans. Everything except for jelly beans, right? A good source of proteins. Yes, garbanzo counts as well. And a good source to lower inflammation. Next one is poultry. Lentils are important as well, yes. Poultry is chicken, turkey, I don't know, maybe even chicken feet, right? Poultry to replace your red meat. And lastly, guys, a glass, for those who drink, a glass of red wine has been shown to be important. For those who don't drink, do not conclude that Dr. Trinh says I need to start drinking, because if you don't drink, don't drink. Don't start. You got 9 other things. If you do drink, red wine. Guys, we're out of time. I know I can go on forever, but which is why I will put my email address here for you guys. If you wanted to email you with more questions. If you don't eat fish, yes, you can take fish oil. If you guys want me to send you a list of anti-inflammatory foods, shoot me an email. I will email you a list of anti-inflammatory foods with that. All right, thank you so much. We're like out of time. I'm sorry, guys, I took up all the times, but I'm gonna give back the time to you guys, and then we'll go from there. Shoot me an email anytime if you want a list of anti-inflammatories, foods, and all that stuff, and I'll be glad to come back and chat with other health topics with you guys anytime. All right, take it away, guys.
Thank you, Dr. Trinh. Really appreciate it. This is Krista again, and it sounds like we have to have a part 2 with Dr. Trinh, because this was very interactive and fun, and we appreciate it. Thank you, Dr. Trinh, for your time and your knowledge. That was fantastic. So just want to remind everybody that we have 2 other virtual sessions coming up, one on August 26th. At 10 a.m. It's integrative health, nutrition guidance for optimal energy, sleep, and cognition. And one on September 9th at 10 a.m. at Eat Smart, the benefits of superfoods. And we're going to have chef celebrity Ball Aronson. So hopefully you can make it. Appreciate you joining us all, and enjoy the rest of your day.